Welcome back. Dr. William Bill Gist is with us today. Dr. Gist is OB-GYN with UT Erlanger Women's Health Specialist. And today we're going to discuss the current birth control options. How many options are there?
Oh, there's a variety of options. We have anything from pills to injections to implants, IUDs, and then of course there's tubules, which is probably the oldest methodology we have out there. And then there's a new one called Essure, which is a rod that gets put into the tube. So there's a variety of choices.
It's called what? Essure?
Essure.
Oh, Essure.
It's kind of like being sure, but Essure.
Yeah. That's the latest thing then, I guess?
That's one of the later things, but the implants are probably newest. There's a new one coming out now called Nexplanon. Previously it was Implanon. It goes in for 3 years and it works really, really well. It's probably one of the best and one of my favorites because it's not use dependent, where birth control pills, if you miss a pill, you can get pregnant. Where Implanon, you don't miss a pill because it's in your arm.
Is it possible that those birth control methods, or some of them, will be phased out over the next few years because, again, the others are better, or is it just...
No, they all have their uses and their needs, so it just depends.
It depends. Are all of them safe?
I think the biggest ones that are safest are probably the birth control pills because they've been out the longest, and we've reduced the dosing so there's fewer side effects. The biggest side effects is nausea and vomiting, but that's not so much of a problem for most of them. And then we have a ring that goes in the vagina, which reduces that side effect. So again, all the options depend on what you want, what the patient needs. And so you really need to take a good history and decide what the patient wants, what their desires are, because some patients don't want to take pills. They'd rather do a ring, or some wants to do implant. So it just depends.
It all depends. Some women complain that they gain weight. Is that in some cases?
Not in the birth control pills. We've studied it, and it's been studied for the longest. You know, they've been out for over 50, 60 years. The older ones probably, the newer ones, we find that the women lose or gain more weight while they're off of birth control, if they're on birth control. So really does not show that. But the implants can show weight gain, and the injections can show weight gain.
As you've said basically several times today, it just depends on the individual. Right,
and you have to select them because if somebody's having a problem already with weight loss, you may not want to give them an implant or injection. So again, it depends on what each patient's looking at.
Now, do you have to do trial and error? In other words, do you try something for 30 or 60 days, and if that doesn't work, then others?
Generally, we try something for 90 days to 120, because when you change, like to a birth control pill, for instance, it can take that long for everything to settle out in your system, for your uterus to settle out and relax and get where it needs to be. So we usually like that. Like IUDs, we like to go 90 days as well, because it's going to be a foreign body in the uterus, and because of that, it irritates the uterus, and with that irritation, sometimes it takes some time for it to settle out.
What would be a normal time for that to do? 90 days?
90 days is probably reasonable.
Yeah. Do younger women have more problems than older, or vice versa?
Older women have more issues with birth control pills because if they're over 35 and smoking, then they're at risk for cardiac events and problems, and blood clots and things like that. So we worry about them a little bit more with that situation. But each one does have its specific utilization.
Yeah. The ones that still smoking, is it changing any? You know, are more women beginning to not smoke maybe and drink when they are pregnant? Well,
drinking is definitely a no-no in pregnancy. We don't want any women drinking in pregnancy. And there's no safe level of alcohol in pregnancy. So it's a no-no. As far as smoking, smoking is a very difficult one. Smoking is socially acceptable, so it's easy to get, and it's tougher to break, and it's really tough to break if you have a spouse that's smoking, so it becomes difficult. But we encourage them to stop, and it does affect our birth control choices for them.
Good information. We thank you very much. By the way, friends, if you would like more information, you can call 778-2580, or you can visit their website, www.erlanger.org. Thank you, sir.
Thank you.
See us. Now, we join Mr. Food in the kitchen. It's time for